Y quiero saber si esto le va a afectar a ustedes, si las agencias que hacen en acceso a esto, y si eso me va a afectar para no van a checar, vamos a compartir con ellos y no van a poder hacerse ciudadanos residentes. Yo como legal pensaría, me da miedo porque sí, muchos sí preguntan eso, pero no.
That's a yes and no question, and I'm going to interject because while no one has access to our system, you're going through a legal service to transform yourself into a U.S. citizen. Now,
Thank you very much.
while
We're gonna have
customs and immigration knows that they can check, they're going to ask you,
Thank you.
are you receiving any type of services right now? For any type of medical, health, or any way that will benefit you? Are you willing to lie?
It's a place where people are being transformed.
Not a lot of people are.
The Word of God, and we live there. Right now we have 24 gentlemen living in the house, and working with them, and I really want to
Right.
thank everybody for having us here. Bow our heads so we can make a prayer.
We've gone through this. I would not encourage us to even answer that. All we can say is, your information will not be disclosed, but I cannot assist you if they ask you any further questions related to any medical services that you
Bueno,
are
es que
interested
it
in.
also really depends on how they ask the question.
Oh, definitely,
Because
again, it all goes back to that we don't want to encourage or stipulate that, no, they will not be affected because we have patients affected by their, unable to become U.S. citizens because legally, if you know, you're not supposed to be receiving any services. These services of Ryan White are not to be paid back. Now, our eligibility and documentation is not, and our service is not to become investigators. And we all know who lives here and who may or may not live here. We're not in the service to go after you and say, whether or not you don't live here. If you can bring us A, B, and C, is what Jessica wants, and you can prove it to the state, then that's where it ends us. Anything else legal, I would refer it back to their legal aid, back to their attorney, back to anything else. We're not providing false hope.
2024, if I can get.
Now, if they're willing to lie
To approve
to them, you think they're not gonna lie to her?
the meeting.
There are no changes, I motion to approve.
Sí, probablemente sí, pero bueno, mi pregunta era si una vez que recibes estos servicios, si hay manera de que
For
se
the administrative
pueda
report, Dr. Chamberlain,
compartirla.
you're gonna say something, Jaime?
Yeah, I'll say something on his behalf. I'm gonna actually give a presentation, but before
Unless
that,
there's a
I just
disclosure.
wanna share some
Unless
light on
Sí,
the.
pero ya
Yeah, but as long as anybody else chooses to
We're
know.
on the ground.
Or the client consent,
For awareness on it, it's gonna be March 1st, Friday, we're gonna do 4 to 6. Sure, we're gonna have signs, and we're gonna be at 8 different locations at the same time with each respective district. So we invite everybody out there, if you guys are interested in joining us, we can connect after, we can definitely take care of
las notas y lo mandas con un folder sellado que no lo pueden abrir hasta no sé cuándo, no sé qué, y piden hablar con el doctor, pero pues
We have a lot
I
of
don't know if you guys are giving me the back.
No,
I'm gonna talk a little bit about,
pero pues
the knock and talk we've been having.
Sí, yo creo
So this is another initiative with
yo
that started with the same overdose campaign. This is us giving education to the kind
Y a
of targeted
sabiendas,
areas, since we did start with our GIS map, we kind of already know where these hotspots are. We're an nation with fire, so we give you like a little brief. So the first knock and talk that we had was February 2nd, and we visited 277 homes and distributed 14 boxes of naloxone.
Bueno, es que ahí también yo no
Educational
conozco el
encounters were
proceso,
so that
no,
meeting
por lo
that we
de
gave them a little
yo
bit of
aquí
education
de
on
lo
what
que nosotros
naloxone
hacemos,
is,
por ejemplo,
how
lo
you
que
can
han
use it,
dicho, ok,
and everything in between.
no van a
how
disclose
even,
la información,
how to
pero
find it.
ya ellos allá si les
This
están
was at the
preguntando,
South Neighborhood.
no sabemos el caso también porque nosotros no vamos
And
a
this is what they
preguntar,
want.
ay, ¿Cuál es tu caso
More of a
migratorio?
visual
Porque
of
pues no es parte
what
del
we visited
protocolo
in
aquí.
that area.
O sea, nada más va a ser
Second.
como que algo muy básico, no, pues no hacemos el disclosure. Pero ya si ellos allá, depende de la situación, o sea, si hacen
So this is moving on to
investigación, ya
February
es cosa de los
We kind
nosotros, no.
of tripled
Ay,
our
¿sabes
homes
qué?
visited,
No.
we visited 600
Ajá.
homes,
Sí.
distributed 37 kids in the lock zone, and 85
Any other
in
feedback from
this is in
anyone else?
Santa Rita neighborhood, in the south.
No,
We kind of had a
This is kind of
question.
the same.
Dr. Fernandez Sanchez, since we've been the ones having
Some
patients
photos.
coming on
We were
Fridays,
gonna do it this
How do you
past night, but
suggest we
waited
do
for
lunch?
So we are gonna continue on this coming
Friday.
Friday.
it's been crazy. We've had to clock out, but be on here, so it doesn't really
Oh,
count.
no, I mean, I would say stay clocked in if you really work. You know, like if you're,
But
don't
then-
clock out and then still be here and
Just
working,
an
you know what I
update
mean?
on Dr. C's.
But then the lunch hour, are y'all,
It doesn't work, so
what doesn't
in a
work?
They
perfect
liked it.
world,
They
that
liked
would
it.
be
I know-
great,
I know
but they go in at
Well, I
11.
went on the first one, not the second one.
sometimes
The
they're-
first one,
Perfect example,
they
they
were open about it.
they ask for
Maybe one or
things
two
while they're in
that
the session.
were
So
negative
we
about
have
the
to
whole
be
thing.
here, like we are with
But you'd be
Dr.
surprised how
Casas, that
the
runs
lock
the day.
cabinets, people
Then
didn't
they
know
come
about
back
it,
after.
shedding
We'll,
light
we'll still
on
have to be
that,
here, so that's what I'm saying.
The Roots
Do
Recovery
we,
Center.
are we going to take our early lunch, or how do you suggest we kind of maneuver that
One or two that had
So
a
if you're
negative comments,
working,
but
and then the client does come in, and has Johnny to follow up.
I have to say it was
So
a.
then that'll be a
it was
working
a-
lunch
it's a
now,
good
if y'all
initiative.
wanna do like, okay, I'm already done, it's already 2 P.M., I wanna take a 30-minute lunch, I brought
Yes.
something, I'm gonna eat it, that's fine, I'm
we
gonna
got
step
it.
out at
She
2
was the
P.M.
second one.
Because I wanna go eat somewhere, grab something, then that doesn't need clock out. If y'all-
Even though it's past the 6 hours, we just notify you all.
The only, when it's past the 6 hours is like if we work straight for 6 hours and leave for the day. Like if we go
Oh,
for the day.
okay,
But
okay.
even if it's 6 hours, it's past 2 P.M. and we take 30 minutes, that's fine.
That's
There has to
okay.
be something in between, that's fine. But if y'all tell me, no, I work straight, I ate like within 5 minutes, and I still have to, then that's a working lunch.
Or if you guys want to alternate it for
Yeah.
Well, some of the houses, of course, we just
For
left
the last 2 weeks, we've been trying to play with it. First, we went in early. We went like 10:30 to and then it didn't quite work out. Then this past one, I was like, okay, yeah, we went to go, we didn't get back, we had to leave that, and sure enough, Marco got the call, hey, I need something for that. So we were like, oh my God, like,
Yeah.
and that's when we were gone for 10
They're
minutes.
in your office, no más, para que coman algo. And then, and if you wanna go, or if you wanna go after the leave, that's fine, pero if you guys want to do half an hour lunch or you
We're still trying to figure out like,
how's it gonna work with him.
or that.
So for,
Yeah, I mean, you know, that's,
Longer to actually engage.
and that's because, yeah, he was already like, I need to go to lunch. So we're trying to.
Maybe it has six hours.
Por eso te digo, like, if.
I mean, if you have 6 hours, you can still, unless you leave, you know what I mean? Like,
No, that's
you
what she was
can- you can-
saying, yeah.
Okay.
We had a misunderstanding about the 6 hours, because Jovina had once said, even if you're working, you cannot work 6 hours straight without a lunch. So I was like, okay, so how are we doing this? Like,
As long as you have a 30-minute lunch.
Engaged that we even open in a lot of
No, o sea, tampoco que no se pasen sin comer, porque si quieren comer a las 11:30, 12, like de voladita, like with them, y luego si van a salir o whatever, pues también, pero like no.
También hay veces que nomás trabajamos a whole 9 hours straight. Now, if that happens, be honest with us and let us know, because I will put in your comment, working lunch because y'all were attending to clients, y'all didn't have a chance to eat. Let's try not to go that route, but I know it might happen, let us know, and we will put that comment. The only thing Gavina wants to see is that Karen got right,
So,
approve that's working straight.
I don't think any of us have ever
Yeah, yeah, we go
used
past
that,
6 and then
but
take
we're
30.
trying to figure out what is suggested, or what can we,
The flyer that we
how we can maneuver
has
that,
that.
because that's a
But then 10
really
degrees,
standard.
that's how we want to.
No.
I know that Gabby, like, Gabby.
Yeah.
Because we're gonna come back and show you how to.
Yes.
Same.
So the flyer that we
So
provided is not.
we'll go pick something and then bring it back, but then,
Same.
the municipality, and we have the information.
It's gonna be like that.
on the other side.
He's coming right outside.
Yeah. It'll be done, that's very.
And that's fine with
These
this.
programs are very important. We said pretty much the schedule we just Bella Cristi or.
Right now, and then, no, it's right.
Okay, I can,
No, I don't have that.
I'm like, maybe.
I can get some right now, I can get it right now.
Christie, just so that she knows which one she's gonna cancel
Stickers there.
and then switch over to
Well,
our.
they are gonna do that, right? They're gonna, Dr. Casi's not gonna see the new client, so the schedule
I
was.
should use them also for our treatment center, so we have special.
We got the same message. We basically, Dr. Casas doesn't want to see any Dr. Dix patients. So I think we need to be, and he's overwhelmed. The man is seeing 9 to 12 patients.
Yeah, he's
Yeah,
staying,
That's why.
he's staying really late.
I know, no one wants to leave at 8 o'clock. and yeah.
Well, thank you, everyone.
We're gonna take the donut or something.
Also, our caseworker has been selected, so she's already going, background check, she should be starting on the caseworker. So she's going to.
Thank you.
Aquí está la.
Thank you, Lydia.
See, you can take it off. Oh, it's okay, it was very informative. And,
I think we should do
Including cocaine, have fentanyl mixed in it. A lot of people thought last year and they got it out of you know how to, what I would actually recommend for, I think a good program, I would recommend that everyone. To know how to use Narcan. And we can probably set that up, and everyone in the program get a Narcan, because they're out there and they're using the, these are people already, I mean, we have, you know, statistically 20% of the clients in the drug court are opiate addicts. So these are the people, and then we're having people with cocaine and fentanyl. These are the people who need it. I would, you know, I would put that as part of our.
And I was gonna ask, I mean, I know that you all are doing knock and talk, but would you all be open to maybe having a presentation with the clients that are present? I mean, for educational purposes, we have received Narcans in the past. We're down to one. We've had to use one on a client twice in the building. So, and then the majority of our clients are alcohol and opioid dependent too.
Yeah.
So.
I'm sorry, I was gonna suggest that we have a program called Recovery Support Services, and we also have a drop-in center.
Okay.
And both programs actually provide psychoeducation for clients on how to use Narcan, and then we provide presentations too, so that's something you're interested in.
So where is it?
That's in Scan.
Okay, so that's what I'm talking about. You know, for example, I would be interested in having Scan set up some psychoeducation for Narcan, where they actually get the training, just like all the professionals did, get that training for all of our clients, have it as part of the program, saying this is a new thing that's coming up because of what's going on. And I would say, you know, let Garcia know, let Dama know, say this is what we're going to do because of the crisis.
Mm-hmm.
You know, we will save lives. You know, we're carrying caseloads of 100 a year with all these people that are more at risk than anyone else.
Mm-hmm.
And so, yeah, I mean, get together with Scan, have them do that program so that not only professionals, but the clients, and then each of them can have their own Narcan, and we spread it out there. Those are the people.
I agree.
We have, the fire department comes to Grace Center, right? Like, probably like, every 2 weeks or, at least once a month to also educate the limit that we have in our program. But it is true what Mr. Hernandez is saying, that it's not that they're using fentanyl, but in our center, I have different cases where I have gentlemen that got overdosed or tubed up at the ICU in the hospital, but they were smoking cocaine, crack cocaine. And, I had fentanyl. I took a gentleman to the doctor, because he was feeling sick. Nothing to do with an overdose or anything, but when they checked his blood, he came out positive for cocaine and fentanyl.
Yeah,
And, but he's like, I never used fentanyl. Like, you know you're using fentanyl.
And at the beginning, the clients will freak out, right? Because, there's this thing, fentanyl, it's
Right.
deadly, you can die, it's a risk, life or death situation, but then they get addicted to it too.
Sure.
So then you're not just looking at cocaine, now they're now only coming out positive for fentanyl.
Exactly.
They now know that they're using fentanyl.
And the euphoria is too great, and that's another thing, that, in addition to this particular thing, I mean, I know that everybody's doing psychoeducation out there for the community, but I just think we need to clarify what's really going on, that fentanyl is not just being used in an isolated situation, it's being mixed. And that would help, I believe.
Jesse, what about a public information, like on the TV, like a commercial, something?
That'd be great. The city fire department are perfectly well equipped to do that.
Talk to the PIO for that one.
I'm just saying that I saw that news report one time, and the public information officer doing a good job, saying, yeah, these are narcotics. And I said, yeah, but you're talking about narcotics in the legal sense, but not really what people think of narcotics. Narcotics are opiates.
I have mentioned it once because I do hear it like in the Mexican radio station, they talk about like they do commercials and they talk about it, and I was like, why can't we do it here?
I mean, we can, I can connect with the radio stations here as part of PIO, and we can get something going for sure. If you guys wanna jump on, or I can do it, I mean, whatever you guys would like.
And remember, there's a connection between alcohol and cocaine, that compadre syndrome, where you have people that are drinking, and then they use cocaine to come up, and now you have cocaine mixed with fentanyl. And that's what happened in January.
There were 3 people that died. I had a girl that went out to my office and she's like, I'm no longer doing drugs, and I was like, wow, that's good. She's like, because the people that died in that house, all 3 together, they were my friends, and I was gonna be there partying with them, and I was like, oh.
Yeah, no, it's.
So it's hitting home, but we do need to put it out there.
Anyway.
If we can make this, not the story, the informational, that, with alcohol involved, LIDE will contribute to paying for that commercial.
Yeah.
Okay, so we just need to get together and write a good informational, to the public, and we can talk I can talk to KTNS or Telemundo, and we'll contribute. Okay, just so you know.
Yeah, no, thank you very much. I mean, whatever it is we need to do, but I just wanted to point that out because it stuck in my craw last month, and I couldn't come last month because of some issues.
I did have just something to add. Aside from SCAN, because they provided us with naloxone, y'all provided naloxone to every member of our engine company also. Another resource, but it's online, and because they're the ones that actually also ship me out my Narcan for free. MoreNarcanPlease.org. Has anybody heard of that one? It's an online resource. It's upon request. They usually send me out 108 units, like 9 boxes of naloxone every month for free. They're based off UT Health Science Center in San Antonio. And only because I also just spoke to the director there on the over here, because somebody from TAMU was asking me if they can get Narcan also. So I was asking on behalf of them. And they also mentioned just another resource, it's an online, it's a request. Sometimes it takes like 2-3 weeks, but they'll ship out to community-based organizations also as well. Yeah. So it's just another avenue.
now that we have the detox open, now that we have some other things, we really need to go back to some of the things we've talked about in the past. You know, for years and years, and Marquita and I have worked together for years, since like, 2009 maybe, 2010. But she knows that I'm a big proponent of Vivitrol. You know, Vivitrol is an opiate antagonist. It blocks the opiate receptors. It blocks dopamine receptors. So people won't use heroin or opiates. It works for alcohol too. And you know, one of the things that we talked about many years ago in the meeting was that if people were going to go into the detox program, there's a 333% more chance of someone overdose now if they go into detox, because they'll go back and they'll use the same amount. And the suggestion that we had talked about was that we set up some type of intermediary program where they have crisis stabilization so that they can get naltrexone. And there's monies out there for naltrexone. The state provides money for naltrexone. There's a coupon for injectable naltrexone, which is Vivitrol. It costs a lot of money, but you know, we have it in our program, and every single grant that I've written always has Vivitrol in it. And I think it's much better than, for me, of course, any medication, assisted therapy is good, treatment is good. But I think that the one that's above all is Vivitrol, because it actually does, you know, if somebody's an opiate addict and they use Vivitrol, they'll immediately go into withdrawals. They won't die, but you can prevent something. We want to, you know, we need to get back and start thinking out of the box again, now that we've got the detox completed. Just a suggestion.
Okay, thank you, Jesse. We're gonna go next to the street guard, which we already talked about. So we're gonna go to a list of available resources. We're gonna do like a list of everybody so we can know what agencies we have available to the public. I know we haven't completed that. I know you're leaving that, but is there like a website maybe in the city that we can get like access, like a page or just like somebody?
For what was that again?
Like to make like a list. I think there was an old list that the city of organizations that provide services, but we need like an updated one.
I can put it on our website. I would have to get all the entities together and have like what we offer and stuff, and then I can create something and put it on our website.
Yeah, because I know Mr. Bird was asking about it the other day, and we just wanted to, a place where somebody that's looking for information can go and check out.
We had that QR code with everybody's flyers. I can get that and then push it onto the website so it can be easily accessible to everybody. And kind of just pin it there. That would be good to search for.
I know in the suicide committee we were talking about how maybe like in the bars they could do like posters and have them like with a word or something, or maybe we can have that at the bars. We can also have those QR codes, and maybe people can access them if they need information. That would be something to ponder. Next, we're gonna go to responsibilities of the committee members. We did get I don't know if everybody got the email. We got an email with an ordinance, and the ordinance states that we need to be present for the meetings. We can only miss 4 meetings out of the year. So just some information. It's on your email. If you can look at it, and maybe next time, maybe we can sign like.
And that would be this one, because the other two, the 2018 ones, say 3. So this is the one that says 4.
Yeah.
The one that is stated for August is the newest one.
Yeah.
So when you get sworn in, you do sign the paperwork, and it is stated there. You get a chance, you can only miss 4. After the 4th one, you forfeit your position, and it goes directly to your representative, and you will be removed and disqualified for any future appointment.
So do we have we established a schedule like every, like
I think we
consistent?
have it, I know this time we moved it because of Valentine's, but it should be the second.
Second Wednesday.
The second Wednesday of every month, I'm sorry.
And it's on Wednesday, sometimes, one time it moved to Thursday, but it's typically Wednesday.
Is everybody still okay with that Wednesday? Yes? Okay, so just make sure to read it, and I guess next time we can, sign it again, and just so we can have them updated. The next is, on the agenda is a detox facility update from the doctor, but I don't know if anybody has an update on that.
On what?
On the detox, since they opened already, if anybody can give us some information, no? Okay, we'll
I
do.
was gonna say, I don't have information on the details, but we referred a patient there, and the process to get someone in there was very simple and easy.
Good.
Great.
And they know they referred the patient to get lab work, and they were able to get the client, the lab work paid for with the city, and client called us telling that he already got lab work and whatnot, and then set up an appointment, so it was very, very easy to go.
And then,
Was your client ever placed on a wait list by any chance?
No.
No? Because we referred one individual, but he's been on the wait list for almost 2.5 weeks.
Yeah, no, well, I actually called with the client, client was present with me, and they just asked to speak to the client to get information. Once they got information, they said, you're gonna get lab work on this day, just make sure you go, tell them you're from like you're being referred to detox, and the process was smooth. The client was scheduled actually to go on Tuesday. I don't know if the client went in and follow up with that.
did your client go, after that, is he gonna go setting that up?
No, the client didn't, the client just wanted detox. They didn't.
Client just wanted detox.
Yeah, they didn't opt for residential. We recommended residential treatment, but the client didn't want that.
And
I know that.
does he have insurance?
No.
Okay, good.
Yeah, we'll see how that is. Okay, anything else?
I have a question for the detox, or what's the criteria for going to detox? Okay, the other reason I was.
We are, more detailed response, I have to connect with Ms. Nudiana, for that. I don't have like the exact details on it, and I don't wanna give you guys false information, so.
I know the last email that they sent out, there was like a referral that was attached
Yes.
to it with like basic information, but I mean, I don't know what the turnaround. Sounds like turnaround was for you like what, 72 days and then 2 in a week?
We're still waiting.
So it's like, and your neighbors too.
I
that
know.
sound like that. But I don't know what the referral process is, but I know there's a form. And you just fill it out and send that stuff.
I know that they do require a
It was
screening.
emailed to the.
Yeah, I know that they do require a screening of, from what we were advised, they have to be actively using. And so there has to be like a diagnosis related to that they need a detox at the time. I guess my issue would be is if they get diagnosed and they still have to wait for a bed, you know, what do we do during that window that we're waiting?
We gave our client options, so we didn't just say, okay, this is loose, you can go to police. We also said, you can try Centipore, you can try outpatient treatment with us while you get while you get ready for detox. The client was already established with us, so they were already receiving outpatient treatment and mat services.
So they were getting medications.
But the client stopped attending services with us for a while, so then it was like, I relapsed on fentanyl, I would like to get detoxed. And so, we gave them a bunch of options, and then they had to decide what they wanted to do.
How was he using fentanyl?
I want to say he was using it nasally.
Okay.
Probably with cocaine.
Well, he was using heroin and so he was doing all of the channels.
Yeah, so he was enhancing it with fentanyl.
And he's also injecting as well.
Okay, so yeah, that's a danger.
Yeah. So this is the reason why we said, hey, we think you should go.
And that could be a reason why maybe you wouldn't have to wait so long, because the one that we're waiting on, he's alcohol dependent, but he gets seizures when he stops drinking.
And alcoholics are
But we
most
have-
dangerous ones to deal with.
But I have a case of a gentleman that was with us in our facility and he left and he relapsed and he's with alcohol, and I know on the 4th, he's gonna be admitted to the detox. to get a detox. I mean, they set him up for 20-some days to be there.
Was he using benzos también?
No, he's all, just
Yeah,
straight.
because you have so many different mixes.
Yeah, but this gentleman, when I had him in my facility, he drank the whole Listerine that we had in our place, so.
Well, that's pretty dangerous.
So he was pretty, he's pretty, bad with alcohol. So, but I know that, the response, because of the response, we referred him there and his family called and everything, and his mom called me that on the 4th, he's gonna be admitted there.
Now, so for example, you have the alcoholics, and even though Vivitrol is very expensive because, it works it's FDA approved for alcohol, it's not only opiates for alcohol, but they can take naltrexone, the pill. I've got a veteran that I'm working with that's on naltrexone, and it's inexpensive. They give them 50 milligrams once a day, twice a day, whatever, usually 50 milligrams, and it works to cut down the cravings and cuts down the use. So if you don't have a program where there's money for Vivitrol, you could get them, if you have a doctor that will prescribe.
Do you know they're using Vivitrol there, Mr. Lopez?
No, they're not.
They're not?
They're not. That was one of our recommendations, but,
Can the patient ask for it?
The thing is, they have to, if they're an alcoholic, they're pretty much clear once they do their liver panel and all that. However, if they're opiate addicts, they have to wait at least 2 weeks before, so they don't have any opiate in the system, because then they'll go into immediate withdrawal. So that's the whole trip with them. The Vivitrol is a good medication, but if you're having issues with alcoholics, have a doctor give naltrexone. I mean, we have to educate, a lot of times we have to educate even our physicians that are out there. Sometimes, that's naltrexone is good, it can work. It's been around for years.
I have a question. So let's just say we were just talking about that. If a client doesn't have insurance with their PCP, what other alternative option is there for the alcohol?
We should, I'm not, look, I would imagine that if they enrolled to Gateway, or even the city of Laredo, Gateway has a psychiatrist, and if they qualify for services Gateway, they may be able to get on naltrexone. Vivitrol is on the formula of veterans, so if any veteran is an alcoholic or using opiates, they can ask for Vivitrol and get it. Or if they want.
I think that the VA does first the pill form, and if that doesn't work, then they'll.
That's their protocol.
The injectable,
That is their protocol, but they can actually do the other one. I had a veteran that was offered the Vivitrol, but he wanted for him, the efficacy for him was better to take the pill than following. So, but you're correct.
What is the name of that called? The medication?
Oh, naltrexone?
Or the alcohol?
Yeah, naltrexone. It's not, and Vivitrol is injectable naltrexone. It's been around for years. Actually, naltrexone was developed around 1985. They were doing studies with Vietnam veterans that were coming back, and they were studying basically the opiate addicts, the Vietnam veterans who were opiate addicts, and they found out that it worked not only for opiates because it's opiate receptor blocker, but they also found out that it's a dopamine receptor blocker, so alcoholics didn't get euphoria. So it worked for alcohol also. And actually, so they've been using it for years for alcohol and for opiates, but primarily alcohol. In 2007 or so, first Vivitrol got approved, the injectable got approved for alcohol first and then for opiates. And we've been using it in drug court since about 2012. 2012.
Mr. Hernandez, is it a treatment or they have to take it for?
No. The treatment is specific. It's you want to take, if you're going to take Vivitrol, you want to take it at least for 13 months. And the reason why it's 13 months is because to go in remission for any substance, it's 1 year. So you have to go through those 12 months. But what you do in those 13 months, you go ahead and provide certain psychotherapy along with treatment. So you provide them the Vivitrol shot, but they have to have certain types of counseling, motivational handling therapy, cognitive behavioral therapy. They have to go to support groups, AA groups, all of that combined over the 13 months time frame, that they're not using will help them. And it's been successful. It's pretty successful. And I don't know, we had a pretty good success rate that first 5 years. We saved the community about $500,000 in hospitalization and recidivism and stuff like that.
I think the hard part was just getting other physicians on board. I remember that we kind of announced it to the community and invited a whole bunch of physicians to come and to TAMIU. Actually, we had the presentation done there, and out of all the physicians, only Dr. Gasabon was willing to help us
Yeah,
out.
he's the one that does it here now. Now, just to remind you too, we used to have representatives from all communities come to our meetings here. They would come to our meetings before the pandemic.
Okay, we're gonna go to our stakeholder agency updates and presentation. I got, to speak to Ms. Tirado. Ms. Tirado also, she's gonna talk about something that's dear to me, just like it's to her, Ms. Alonso, and, people here. Ms. Tirado, si quiere dar su presentación, she's gonna give it in Spanish, so, okay?
Sure, of course.
¿Aquí lo puedo? Sí.
Buenos días, primeramente quiero dar gracias a Dios por la oportunidad que me da de estar aquí y compartir con todos ustedes, ¿verdad? Y darle también gracias a Dios porque veo que Laredo ha tomado conciencia de lo que ha estado pasando. Hemos visto que muchos jóvenes están muriendo a causa de las drogas. Y antes nuestros hijos, lo digo nuestros hijos porque somos muchas madres las que hemos perdido, para Laredo era, con todo respeto, un número más. Murió y ya no se hacía nada. Yo ahora, en mi persona, he visto, ¿verdad? Me invitaron hace unas 3 semanas para dar mi plática también a las consejeras de los distritos de los 2 Laredos. Y el Señor me usó de gran manera porque muchas veces no sabemos qué tan está grande el problema. Creemos que a nuestros hijos no nos va a alcanzar. Creemos que esto nada más le da a la gente que anda en la calle. No, esto es en general. Las drogas están en nuestras propias casas. Nuestros hijos a veces sin querer las toman. En lo particular, mi hijo murió de 30 años. Mi hijo era un hijo excepcional. A los 19 años él nos compró nuestra casa. Trabajaba en Andorias, todo estaba bien. Nosotros como padres nos preguntamos, ¿en qué momento? ¿En qué momento? No hay explicación en qué momento. El enemigo está al acecho de nuestros hijos y tenemos que levantar banderas sobre la exploración de nuestros hijos porque no estamos exentos a que nos pase esto. A la edad de 19 años nuestro hijo nos compra nuestra casa, era todo felicidad. Nosotros siempre hemos sido una familia que hemos servido al Señor, para honra y su gloria le alabamos, ¿verdad? Y le servimos. Dices, ¿en qué momento? Me preguntaban mis amistades, ¿en qué momento se te fue de las manos? No sé en qué momento. Mi hijo primero empezó con marihuana. Yo creo que para él ya no era suficiente el andar con sus amigos, después empezó con cocaína. Él empezó a la edad de 21 años a ingerir drogas. Él dejó de trabajar a los 24 años. Se buscaba la manera él de que en su trabajo no se dieran cuenta que él ingería drogas, hay muchas cosas, ¿verdad? Nosotros veíamos que algo estaba pasando en su vida. Siguió con cocaína, después la cocaína no fue suficiente para él, siguió con la piedra. Nosotros como familia sabemos todos los efectos de diferentes drogas. A mis hijos de 15 años y de 21 años los hice madurar muy pronto, porque yo les dejaba la responsabilidad a mis hijos de que yo me iba a trabajar porque teníamos que trabajar mi esposo y yo, y les dejaba la responsabilidad de que checa a tu hermano, y checa si está respirando, y checa si esto. A mi hijo de 21 años, su hermano se le dobló varias veces, y no había eso, que ahora hay, lo que les ponen en la nariz, ¿verdad? O si lo había, nosotros no sabíamos el alcance de eso. Mi hijo prácticamente lo llevaba al hospital, lo llevaba a la ambulancia. Mi hijo de 21 años se me empezó a descarriar también. Tuve que con todo el dolor de mi corazón mandarlo a la escuela de Jumpers para salvarlo, alejarlo, de que ya se le iba a hacer fácil ver a su hermano y ya empezaba él también con la marihuana. Entonces dije yo, no, dije voy a tener que alejarlo. A mi hijo, el que murió de 30 años, lo mandé a muchos centros de rehabilitación, lo mandé a Saltillo, lo mandé aquí. Él no sabía yo qué quería para su vida. Como padres siempre estuvimos ahí para él. A él, por andar robando, le cortaron su mano. Su mano prácticamente quedó solamente colgada de esta mano. Lo trasladaron a San Antonio de emergencia. Después, por andar en la calle, porque él ya andaba pidiendo dinero en la calle. Yo veía que ya la cocaína lo estaba consumiendo, él estaba flaco, pero después me di cuenta que él ya empezaba a inyectarse, ya empezaba con heroína. Nosotros en la casa veíamos, él estaba encerrado en su cuarto, y a veces para uno como padres es más tranquilidad ver a tu hijo, saber que está ahí, porque no sabes qué va a pasar en la calle, pero es una tranquilidad equivocada, porque tú dices, ay, mi hijo está ahí encerrado, ya sé lo que está haciendo, pero aquí está en la casa. No, se puede decir que es algo que uno lo conforta, pero es algo que conforta equivocadamente, porque estás contribuyendo a que tu hijo se esté drogando. Me decía, mamá, ya nada más me faltan 3 horas para completar. Con todo el dolor de mi corazón yo le decía, no, hijo, yo no voy a ser partícipe a que yo darte dinero para que tú te drogues. Mamá, es que prefieres que yo ande pidiendo en la calle. Yo lo veía a mi hijo pidiendo en las esquinas. Lo veía que gente lo rechazaba. Yo lo casaba, y le digo lo casaba porque yo me salía en las madrugadas. Quería saber dónde estaba mi hijo. Yo me salía y yo agarraba mi camioneta y yo me iba. Yo le decía, Señor, tú pon Espíritu Santo, ¿dónde está mi hijo? Y lo veía en una gasolinera pidiendo dinero. Y veía cómo la gente lo humillaba. Y le decía que hazte para allá. O yo me acercaba y le decía, hijo, vámonos a la casa. Y me decía, no, mamá, pues ya no me faltan $3 o me faltan $2. Y había una voz que Dios me decía, no caigas, porque tú vas a contribuir a que tu hijo siga drogándose. Yo me retiraba y lo veía de lejos y él sabía que yo lo estaba viendo. Y él solamente me decía, ándale mamá, ándale, ya solamente me faltan $2, me faltan 50 centavos. Ver que tu hijo se está humillando por 50 centavos es algo muy difícil como uno como madre. Pero el Señor me dio la fortaleza para no caer en eso. Y me decía, vete entonces, si no me vas a ayudar. Entonces yo con todo el corazón, mi corazón me iba a la casa. Y yo en el teléfono esperando que me hablaran, esperando que algo le pasó. Después lo balacearon, entró una bala por aquí y le salió por la pierna. Lo volaron otra vez a San Antonio. Pasé demasiadas cosas con él. Después lo atropellaron, su pie literalmente quedó colgando. Lo volaron otra vez a San Antonio. Fueron 5 años de diariamente esperar qué iba a pasar. Yo encontraba las jeringas en el baño. Mis hijos en ese tiempo, mi hija tenía 14 años y el de 21 veían las cosas ahí y me decían, mamá, ya otra vez Jonathan está haciendo eso. Era muy difícil para mí lidiar con eso, porque ves que tu hijo te está yendo de las manos. Mi hijo en el marzo 21, él tenía corte, porque para eso él tenía cortes de todo, de robo, de que había metido a una casa, de que andaba con un muchacho que no era su camioneta y que se habían agarrado. Ellos hacen tantas cosas por sobrevivir en su mundo, ¿verdad? Equivocado. Y nosotros como padres siempre apoyándolo, que él cayó en marzo 21 y él tenía corte el siguiente día. Ese día en la noche mi esposo y yo lo estábamos buscando porque dijimos, si él no se presenta en la corte le van a arrestar. Y él ya había estado en la cárcel. Y lo van a arrestar. No lo encontramos. En la madrugada nos hablaron del hospital, que mi hijo estaba en cuidados intensivos, que necesitábamos ir porque él no iba a pasar la noche. Yo llegué y mi hijo estaba completamente entubado y el doctor me dijo, él no va a pasar la noche. Yo me hinqué en ese momento y le dije, Señor, tú tienes el poder para levantar a mi hijo de esa cama. Tú lo tienes, Señor. Las enfermeras entraban y se me quedaban viendo y diciendo, ¿esta señora qué está haciendo? Y me dice mi esposo, vete, párate, lo van a checar. Le digo, no, yo no voy a dejar de doblar rodillas, el Señor va a levantar a mi hijo de esta cama. Y yo lo tocaba a mi hijo de sus pies y de su cabeza, y yo le decía, Señor, tú tienes el poder para levantar a mi hijo de esta cama. Tú me lo diste, Señor. y tú sabes, y no me niego a tu voluntad, Señor, pero yo ruego, Señor, que tengas misericordia de la vida de mi hijo y de nosotros. Mi hijo pasó esa noche, pero su corazón bajaba. No me dejaron quedarme esa noche. Yo a las 7 de la mañana llegaba. Mi hijo duró 1 mes y medio en cuidados intensivos. Y yo llegaba desde la mañana, yo paré de trabajar, mi vida se paró. Y mi esposo me decía, yo no puedo parar de trabajar, yo tengo que seguir trabajando porque, pues, ¿cómo vamos a sustentarnos? Yo paré de trabajar. Yo me llegaba a las 7 de la mañana a cuidados intensivos y hasta las 9 de la noche que me dejaban yo me iba. Y yo todo el tiempo estaba pidiendo a Dios, Señor, tú tienes el poder. Los doctores entraban y me decían, señora, ya no hay nada que hacer. Su hijo está conectado simplemente por la máquina, por el tubo. Yo le decía, no, Dios lo va a levantar de él. Una mañana llegó una doctora y me dijo, vamos a quitarle el oxígeno para ver cómo reacciona. Vemos que su organismo está respondiendo. Mi hijo respondió. Cuando mi hijo respondió, que él se despertó, mi hijo quedó como un niño con retraso mental. Él no podía hablar, él no podía caminar y no podía ver. Dijimos, vamos a ir viendo. Dijo, lo que le encontramos en su cuerpo fue el fentanilo, eso. Marihuana, encontramos cocaína, encontramos crack, todo eso. Entonces dijo, vamos a ver qué es lo que va a ir pasando con su hijo. Lo pasaron al cuarto regular, dijo, yo lo tenía que cambiar de pamper como un bebé, pero yo notaba que mi hijo no veía, porque él me decía, oye mamá, prende la tele, dijo, la tele está prendida, dijo, no, pero él empezaba a hablar, él por ejemplo, empezaba, mamá, él, o sea, no decía las palabras completas. Entonces yo le decía, ¿dónde? ¿Qué está pasando? Dijo, lo que pasa es que cuando a él lo encontraron, ya tenía 2 horas inconsciente, dijo, y sus células del cerebro, su oxígeno no pasó suficientemente oxígeno al cerebro. Entonces esos fueron los resultados del que dijo, no sabemos si él va a volver a caminar, no sabemos si él va a volver a hablar, no sabemos si él va a poder regresar a su vista. Dijo, ya hemos hecho muchos estudios y todo nos indica que no. Mi hijo empezó a hablar, yo no dejé de orar. Mi hijo empezó a hablar, mi hijo empezó a caminar. Decía, yo puedo, mamá, yo puedo. Me le decía, hijo, tú puedes. Y cuando yo lo bañaba me decía, deja que yo me talle solo, mamá. Y él empezaba a tallarse, pero pues batallaba porque sus extremidades estaban completamente muertas. De ahí me lo pasaron a una clínica enfrente, que es como clínica de rehabilitación, donde empiezan a tratarlos para que caminen, para que ellos empiecen a hablar, para estimular sus músculos. Pero él no veía, yo veía que ya caminaba lentamente, hablaba pausadamente, pero él no veía. Entonces lo llevamos como a 3 tipos de doctores. Fueron ahí a la clínica y dijeron, no, pues es que no nos entendemos el por qué. Mi hijo sale, después de 5 meses duró todo este proceso, sale, lo llevo a la casa y él me dice, ya, esto que yo pasé y que Dios me dio otra oportunidad, ya en mi vida ya no va a volver a pasar, mamá. Y yo le decía, hijo, Dios te levantó de la muerte, hijo, porque precisamente cuando nosotros llegamos al hospital, me dice la enfermera, es que ya cuando llegó aquí él murió, señora, por minutos, me dijo, y lo revivieron. Entonces le dije, hijo, Dios tiene un propósito en tu vida. Dijo, le dije, tú tienes que aprovechar esta oportunidad que Dios te da. Y él estaba convencido, sí. Cuando él lo llevamos, nosotros lo mandamos a un centro de rehabilitación en Saltillo, era un centro de rehabilitación cristiano. Y muchas personas aquí conocen de la palabra de Dios. A él le profetizaron que él iba a ser un gran ejemplo para otros jóvenes. Y es aquí el por qué estoy aquí. Porque yo puedo, por medio de mí, ¿verdad? Que mi hijo ya no está, yo puedo hablar sobre su vida y yo sé que puede alcanzar a diferentes jóvenes las situaciones que pasan, las situaciones, los estragos que trae a la familia el tener una persona con adicciones. A él le profetizaron y él dijo, mamá, yo voy a ser una persona que mi ejemplo va a servir. Yo le decía, sí, hijo, tu ejemplo de lo que tú has pasado, tú vas a servir a otros jóvenes, hijo, le decía yo. El 12 de agosto, en ese tiempo mi hijo cuando veía estaba en casa, ya en la corte lo habían discapacitado, la jueza le dijo, tú no puedes ir a la cárcel porque no estás en condiciones para que tú vayas a la cárcel por los delitos que él había cometido, porque en ese tiempo En una ocasión él me decía, mamá, dame ray, mamá, a conectar, así, ya descaradamente. Y en ese tiempo yo le dije, no, hijo, yo no te voy a dar. Te voy a dar ray y te voy a dejar en una parte, pero llevarte ahí no. Y entonces yo tenía que llevar a su hermano al doctor. Cuando nosotros llegamos al doctor, él me dice, mamá, anda, mamá, dame ray, déjame en tal lugar. Le dije, no. Le dije, ¿quieres esperarte aquí en el carro? Ahorita que me vaya, te llevo a otra parte, pero ahí no. Yo me bajo al doctor y yo me recuerdo que la niña traía todo en la cajuela de los uniformes. Él ya agarraba cosas de la casa. Y le dije, regrésate y agarra tus cosas porque tu hermano te lo va a llevar. Cuando él va, le muerde la mano a la niña para quitarle las llaves y se lleva al carro. Y yo me puse a orar en ese momento, le dije, Señor, ¿qué hago? Yo escuché la voz de Dios que me dijo, es el momento. Y le hablé a la policía, a él lo encerraron 2 años, porque era una agresión sobre una menor. Entonces todo eso él pues cumplió sus 2 años, pero todavía tenía ese proceso en la corte, ¿verdad? Y la jueza iba a determinar si él iba a regresar a la cárcel o él o qué iba a pasar. Entonces cuando la jueza lo vio en esas condiciones que mi hijo no podía caminar, nosotros teníamos que guiarlo. La jueza dijo, no, es que ya se tiene que discapacitar. Muchas veces uno no comprende el por qué hace Dios las cosas, pero Dios es tan perfecto, tan perfecto. Nosotros seguimos con él en la casa, lo ayudábamos, y en una ocasión cumplió años y un amigo le dijo, ven, vamos para darte un trip en el Laredo y que no sé qué. Cuando mi hijo regresó yo lo noté raro y yo le dije, ¿tomaste, hijo? Porque el doctor ya le había dicho del corazón. Tu corazón quedó como lo de un joven, como lo de un anciano. Si tú vuelves a tomar alcohol o vuelves a drogarte, tú vas a morir. El doctor le dijo del corazón. Y él, no. Yo lo noté raro. Entonces yo le dije a mi esposo, algo está pasando. Después él ya perdió el miedo y se volvió a salir sin ver. Él, yo creo del 100% que nosotros vemos, yo creo que él veía un 10%. Decía que veía sombras, que las cosas las veía dobles, y él se salió. Y eso fue como a principios de agosto, que él empezó otra vez a quererse salir, y otra vez yo iba a buscarla, porque decía, si no ve cómo anda en la calle, y siempre andaba acompañado de un amigo, de alguien. Cuando nosotros tuvimos todo, pues ya después vimos que mi hijo se había vuelto a drogar, porque ya vimos las reacciones que él tenía. Ya no sabíamos todas las reacciones cuando él hacía cocaína, cuando él hacía marihuana, cuando él hacía la piedra, cuando él hacía heroína. Nosotros ya sabíamos todos los efectos. Mis hijos, el de la niña de 14 años y mi hijo el de 21, ya sabían perfectamente qué es lo que él traía en el sistema por las reacciones. Porque nosotros como familia tuvimos que ir a terapia porque lidiar con una persona adicta es difícil. Es difícil. Él quebraba cosas en la casa, me quebraba ventanas, me quebraba cosas, la desesperación lo hacía. Y nosotros, yo al ver a mis hijos que los estaba haciendo madurar tan rápidamente, yo dije, mis hijos necesitan ayuda psicológica. Yo los llevé a ayuda psicológica y para poder lidiar con una persona adicta. Y entonces ellos empezaron a asimilar eso.
Un minuto más, sí, porque tenemos
minutos. Disculpen. Entonces, para acabar, nosotros tuvimos la quinceañera de mi hija el 12 de agosto y todos muy felices. Mi hijo estaba en la quinceañera. El 15 de agosto yo me voy a trabajar y veo en la cámara que está la policía y le digo a mi hijo el de 21, porque él trabajaba en las carreteras en la noche, le digo, hijo, baja porque es de tu hermano. Me dice, mamá, tengo miedo. Dije, es de tu hermano. Y me dijo, baja, y yo lo veo por la cámara que mi hijo agacha la cabeza. Me dice, mami, regrésate. Me regreso. Cuando yo llego, me dicen, estaban los investigadores, estaba la policía, y me dijo, su hijo lo encontramos tirado. Lo encontramos tirado. Lo encontraron a las 7 de la mañana y estaba sin vida. Todo indica que fue una sobredosis. Cuando yo voy a la funeraria, ¿verdad?, a arreglar todo, me dice el de la funeraria, no es para consuelo, dice, pero su hijo tuvo un ataque fulminante. Dice, ustedes van a darle los resultados del por qué le causó ese ataque fulminante. Yo claramente sé que pues fue la droga, ¿verdad?, el que le dio el ataque fulminante a mi hijo. Y Dios me ha dado mucha fortaleza, el Señor me ha dado la fortaleza para, ahora sí que puedo experimentar la paz que sobrepasa todo entendimiento, porque es muy difícil, Marina lo sabe, perder a un hijo por esas causas o por cualquier causa, pero es muy triste en esa situación. Les quiero agradecer el que me hayan escuchado, el que pueda yo tomar un poquito de conciencia, ¿verdad? Como padres, algunos nosotros aquí somos padres, el que pongamos alerta sobre nuestros hijos, el que podamos ver y agradecer a Marina el que me haya invitado, que haya invitado a expresar esto y darle la honra y la gloria a Dios, porque Él es el que me ha sostenido hasta este momento.
Muchas gracias.
Muchas gracias. Su historia, lo mío, es casi todo igual, casi todo como empiezan, como terminan. Gracias, mi estimado, por darnos su historia. That's all we have for this meeting. Thank you. We will be meeting. Next meeting will be March the 13th, and I would like to motion to adjourn.
Motion.
Ms. Alonso? Second?
Second.
Yes. Thank you, everybody. Again, there's lunch there. If anybody wants to provide lunch for the next meeting, y'all want to sign up, you're welcome.